Blood pressure, you hear about it all the time. When we visit a doctor, one of the first things they check is our BP. But do we actually understand what those numbers mean? Some people say, my BP is high, while others complain of low BP. Both conditions sound simple, but they can affect the body in very different ways. So today, we're breaking down hypertension and hypotension, what they are, how they differ, symptoms, dangers, and how to prevent both. Let's begin by understanding the basics. 1. What is blood pressure? Think of your heart as a pump and blood vessels as pipelines. Every time your heart beats, it pushes blood with a certain force. This force is called blood pressure. If the pressure is too high, it strains the heart and damages blood vessels. This is hypertension. If the pressure is too low, not enough blood reaches vital organs. This is hypotension. Everyday example. Imagine water flowing through a pipe. If the pressure is too strong, the pipe may burst, like high BP. If the pressure is too weak, water won't reach the required level, like low BP. That's why maintaining balanced BP is so important. 2. Understanding BP numbers. Doctors measure BP using two numbers: systolic, upper number, pressure when the heart pumps. Normal, around 120 millimeters of mercury. Diastolic, lower number, pressure when the heart relaxes. Normal, around 80 millimeters of mercury. So when you hear 120 over 80, that's a healthy average. If systolic greater than or equal to 130 to 140 repeatedly. Hypertension. If systolic less than or equal to 90. Hypotension. 3. Hypertension. Hypertension is when your BP stays high for a long time. The scary part? It often shows no symptoms at all. That's why it's known as a silent condition. Inside your body, high pressure slowly damages heart, blood vessels, kidneys, brain. If untreated, it can lead to stroke, heart attack, and kidney failure. 4. Hypertension. Explained. Hypertension is the opposite when BP is too low. This means your organs are not receiving enough oxygen-rich blood. Common symptoms include dizziness, fainting, fatigue, weakness, blurred vision. In severe cases, dangerously low BP can lead to shock, which is a medical emergency. 5. Causes of hypertension. Hypertension develops gradually over months or years. Top causes: eating too much salt and processed food, being overweight, lack of exercise, high stress, genetic smoking and alcohol. Older age, example, eating chips, pickles, and instant noodles regularly increases sodium in the body, which raises BP. 6. Causes of hypertension. Hypertension usually results from dehydration, nutrient deficiency, B12, folate, iron, thyroid or adrenal issues, side effects of medicine standing up too fast, blood loss. Example, playing sports in hot weather without drinking water can cause sudden low BP and dizziness. 7. Symptoms. Hypertension versus hypotension. Hypertension symptoms: headaches, dizziness, nosebleeds, chest pain, blurred vision. But many people feel perfectly fine even when BP is dangerously high. That's the danger. Hypertension symptoms: fainting, lightheadedness, weakness, nausea, cold, clammy skin. Symptoms appear instantly because the blood flow drops suddenly. 8. Risks and complications. Hypertension. Risks: heart attack, stroke, kidney damage, eye damage. Like overfilling a balloon until it bursts. That's what high pressure does to blood vessels. Hypotension risks: fainting injuries, confusion, shock organ failure. If BP becomes too low, vital organs stop receiving enough blood. 9. Quick comparison: hypertension versus hypotension. Feature: hypertension, hypotension, meaning high BP, low. BP reading above. 130/80, below 90/60. Danger long-term organ damage. Sudden fainting, shock symptoms. Often none. Immediate risk, group older, stressed, overweight. Young women, dehydrated treatment, lifestyle plus meds. 10. Prevention and lifestyle. Tips for hypertension: reduce salt, avoid junk food, exercise 30 minutes daily, lose weight, manage stress, stop smoking and limit alcohol. For hypotension, drink plenty of water, eat small, frequent meals, increase salt only if advised, stand up slowly, correct deficiencies, treat thyroid or adrenal issues. Section 11. Why people get confused between hypertension and hypotension. Many people mix up the two conditions, and it's very common. Here's why. Both involve the word blood pressure. People assume both are similar because they relate to BP. 2. The terms sound similar. Hypertension and hypertension differ by only 2 letters. Easy trick. Hyper equals more, high BP. Hypo equals less, low BP. 3. Overlapping symptoms. Dizziness can happen in both, so people often misjudge. 4. Lack of awareness. People think only high BP is dangerous, but extremely low. BP can also be life-threatening. This confusion often leads to wrong assumptions and delayed treatment. Section 12. When should you see a doctor? You should get medical attention if you notice the following. For hypertension, persistent. BP, above 140/90, despite rest. Frequent headaches, blurred vision, chest pain, shortness of breath, family history of heart disease. Hypertension is silent, so regular checkups are important even if you feel fine. For hypotension, regular fainting spells, dizziness whenever you stand, weakness and fatigue even after eating, blurred vision, very low readings like 80/50 or lower symptoms during dehydration or heat exposure. Emergency signs for both: sudden confusion, loss of consciousness, severe chest pain, trouble speaking, rapid heartbeat. These could indicate stroke, shock, or heart attack, needing immediate care. So this was a complete breakdown of hypertension and hypotension, what they are, how they differ, their causes, symptoms, major risks, and how to prevent them. In our next video, we cover the complication of hypertension. If you found this video informative, don't forget to like, share, and subscribe to our channel for more helpful health education. Stay healthy.